No.
Okay. Good morning. My name is Dr. Huang with Westchase Wellness Chiropractic Center. We're going to demonstrate with using the Arthrostim. I combined a few different techniques in my office for Arthrostim. I could use Dr. Brimhall technique, Dr. Alan Cree technique, and KST technique. So I kind of blend them together. And I'll demonstrate how I do that here in the office. Here we go. This is Arthrostim adjustment. And this technique right here is, I think Dr. Brimhall really did a great job on demonstrating that technique. And then after I do this, actually I go into the range of motion for the patient. And Dr. Alan Cree should kind of develop that a little bit. So all this great technique involved to help people function better, move better at night, better range of motion. The key is to have better mobility the whole time in your life, so you don't have any loss of range of motion. In other words, if you sit in front of a computer all day long, which a lot of people do in this world, and they typically have a neck issue or upper back issue or loss of range of motion. And if the neck issue occurs to a long time, it can lead to low back pain, because neck and the lower back has a brotherly relationship. And if you work on the whole entire spine, which we do here in this office, that's what kind of quality life you get. Better mobility, less wear and tear to your spine. And it's good to have that joint move, because when you don't move it, in 20, 30 years from now, you have a condition called arthritis. What is arthritis? It means bone has deteriorated changes in your spine. And a lot of time, people who have a good example is like cavity in your teeth. If you don't take care of your teeth, you have time to go see the dentist, make a correction on your teeth. The spine has cavity just like the teeth does. That's called arthritis. And I use another tool here to kind of tap down the spine. And would like to do that. Dr. Brimhall will get to do that. Show you doing that. Very good. And this is basically tap the whole spine. And then in a second, I'll use KST technique, a tapeworm specific technique on her. And sometimes after I finish, if she has more discomfort, I'll do some muscle work to help her with the discomfort. This too is very versatile. You can do a lot of adjustment on the spine. Good. Now I'll do a little bit of tapeworm, and it's quite nice technique to get people well. Great technique here. Good. We need a little bit more on the L2. People have low back issues, could be constipation, diarrhea, bloatiness, irritable bowel problem, menstrual cramp, bladder problem, sexual organ not working correctly, and low back pain numbers down your leg. That's when people have low back issue. And chiropractic adjusts the spine so the body can function better, regular correct, and heal itself correctly. That's what it does. this body is made amazingly well. God made this body to heal itself, and it will do that correctly every single time. And the body has an amazing ability to heal itself. I'm going back same area. Obviously, the bone is like, hey, I need more attention here. I need more help here. So we're going back same area to move the joint. I'm down the sacrum right now. So adjust the foot now. Left foot. There's 8 bone in the foot. We're adjusting the first one right there. We got just an ankle now. She is complaining about left side of foot being, left side of leg being painful, and back of right, left hamstring too. So perhaps these are all causing the pain. So we're adjusting those joints to see what else shows up. Okay, more to her foot. So we're gonna work on the calcaneal bone right now. And I'll lift that up, and I'll like to tap into the calcaneal. It's fixated there, so this is another way to get people better. And this area is called the motion portion of the experience right now. And we treat it by the Arthrostim. There's many ways to do the emotional portion here. We'll do emotional technique using different color lenses and tuning fork. And this is a good way for the specific technique. So we walk around where the body tells us what to go next. Okay. We're going to adjust this T5 now. Okay. Still doesn't have moves. I'm going to change her. See if we can fix that issue. T5 is pretty stubborn today. I applied EKSD a little bit, applied kinesiology technique involved with that. Going back to the same area, a little higher slightly. Use it T7. Our alignment there. Boy, there's a lot of things show up today on her, so it's good to move these joints so she can feel better. Got a little more emotion that I have to address. Just go right down to sagittal suture of the skull. So we do specialize in craniosacral technique. This particular Arthrostim technique, Westchase technique. I also specialize in kid adjustment and of course adult and athlete. We do a lot of nutrition in office too. If you're pregnant, want and get some advice on nutrition before you get pregnant, during pregnancy, we can help you with that too. I'm going to adjust her knee right now. This is the field of the head. Adjust that field of the head a little bit. She's complaining a lot about her left side being painful. Just going back and forth to make sure everything clear out correctly. I'm very detail oriented when it comes to adjustment. Good. Alright, this is typically how it looks like in my office using Arthrostim, using very different technique to cover the whole entire spectrum to help her align her spine correctly. And if you want more information about it, please look up at westchasewellness.com. Please like us, subscribe button, hit the subscribe button, and the notification button so you notify when we get a new video. Also, share the video. Thank you.